Hi, my name is Amy, and this is my insertion and discontinuing of an IV. I'm going to verify the provider's orders, make sure my patient needs an IV, go to the patient's room, close curtain door, give them privacy, and then verify 2 identifiers, so name, date of birth. And then from here, I'm going to explain to them that I'm going to be doing an IV on them, and gather my supplies here. So I have an IV starter kit. I'll just put that up. And then my extension tubing. So I'll open that up, and I want to make sure I maintain my sterile field with that one. And my needle with catheter. And this is a 20 gauge in 1 inch. I would actually use a 22 in 1 inch, but I used all mine practicing, so I'm using this one. But that's not the one I would actually choose for that patient. So if the patient was having trauma or surgery, I'd go with like an 18. And from here, I'm gonna go ahead and do my hand hygiene. And apply clean gloves. And set up my push first and tubing. So I'll just go ahead and pick this up, and you want to make sure you don't touch the ends. And I'll just remove this cap and grab my sterile fluid for my push and remove that, and then we'll just attach that on. And then from here, I want to make sure I get all the bubbles out, just a little bit here, and then go ahead and set that back on that sterile field. Now I'm gonna get the patient set up, so I'm gonna most likely go for their medial cubital, but I would want to apply my tourniquet first. I'm gonna pull that down. In this case, I'm using a box, so my tourniquet won't go around it, but I would tie my tourniquet on, and I like to do like 1 bunny ear so I can just easily snap it off. And feel for a distal pulse to make sure it's not on too tight. And you're gonna go 15 to 10 cms above wherever we're gonna insert our needle. From here, I'm gonna use alcohol for this demonstration to clean the area. If we were gonna do like chlorhexidine, or betadine, we would want to do a back and forth motion for 30 seconds. But with alcohol, we're just gonna do a circular motion, kind of going from inside out. And once that's done, I'm gonna go ahead and grab my needle and make sure that my bevel is up. And about 1 inch to 2 down, I'm gonna use my non-dominant hand to anchor that vein down for when I insert. So here, I'm just gonna go ahead and insert that needle about 1 cm or 2 and see if I get a flash. Once I get a flash, I wanna go down another 1/4 inch. So like so. And then from here, I'm gonna hold this up here and kind of apply some pressure so my blood doesn't come squirting out, and I'm gonna push in the catheter further. And retract my needle and place that in the sharps container. And from here, I'm gonna attach my extension tubing. Make sure I have that on. Okay. And then we'll just go ahead and push and make sure the patient's doing okay. Notify them, maybe some stinging or burning, depending on what we're pushing here. So I'm just gonna push that. And that is all done. So I would remove this end. Actually, before I do that, I'm gonna actually clamp it. So when I don't get blood return or anything like that. blood squirting out. Perfect. Right, I have that. I'm gonna go ahead and remove this and kind of coil it up here. Avoiding touching that. And I'm going to tape that down. Anchor that. And apply my Tegaderm to hold this in place. And I want to make sure that I still can kind of see the skin. Press that down, and then from here I can further tape and make sure everything's secured in place. Let's secure that better and remove this one. Okay, so there's my IV. Now I'm going to go ahead and dispose of everything in the correct bins that they need to be disposed in. And remove my gloves, perform my hand hygienes, go do my documentation, and also write in date, time, what gauge was used, what was pushed, and everything kind of on my Band-Aid so people know when this was on. And then from here, I'm going to go ahead, come back, do my hand hygiene again, get some fresh, clean gloves. And we're going to go ahead and remove the IV and explain to the patient that I'm going to go ahead and be removing your IV. And you're going to want to do it usually very last minute. Make sure that the doctor actually wants it removed. So from here, I'm going to go ahead and untape that. And go ahead and pull this off very gently, and holding that in place. And then right above, I'm just going to slowly take out the catheter and hold pressure for 30 seconds, making sure my catheter is intact. If everything's good with this, I'm going to go ahead and put that in the sharps container, and I would either kind of check and put like a Band-Aid on it, and then remove my gloves, do my hand hygiene, and document everything. And that is my video. Thank you.